House Republican leader Tony McCombie. I represent the 89th District, which is the Northwest Illinois corner. I'm here with my colleagues today to discuss a clear need for transparency and accountability in our state government. This week, we've had two different audit reports of state agencies revealing horrible problems and an important hearing on the work of another agency. Audit reports are the only source of agency accountability that we as Republicans have access to. And of course, the problems go beyond this week's news and continue to plague the state. The Department of Children and Family Services issues brought to light this week brought to light the fact that they're putting children and workers at risk. Many of the issues that we heard are repeated findings and continue to be decades old. Department of Corrections, an audit this week illustrated that the lack of reporting for sex offenders being released into our communities. And then the Illinois Department of Financial and Professional Regulation. Our caucus started conversation months ago with the department, and at a hearing this week, thankfully called by one of our colleagues on the other side of the aisle, called attention to the severity of professional licensing processes and issues, especially in industries that we need the most. I could give you several more examples, and I'll just give you a few. Department of Employment Security, fraud costing the state and taxpayers over $5.2 billion in COVID-era overpayments within the unemployment system. Department of Human Services, abuse and neglect at our mental health and developmental centers. Department and Innovation and Technology, do it. It was hacked. Total lack of transparency and understanding who was hacked, what information was taken, and what is the cost. Central Management Services, procurement processes, hiring. How are we going to speed up the procurement processes and bolster hiring where it is needed? There's excuse after excuse, blaming previous agency directors, budgets, staffing needs. Systematic problems go beyond these repeated excuses. We need to acknowledge the problems, and those reports have provided us answers to where the fault lies. Now, as lawmakers, it's up to us to make the changes we need for the people of Illinois, the people we serve, and those who rely on the state agencies for their well-being. To act, we need access. Republicans are shut out of the process, and we're tired of it. We're here to work. We're here to provide solutions. So today, we're here again for a call to action. Work with us. These are not partisan issues. These are human issues. I know there are Democrat lawmakers out there who are willing to work with us. We welcome their support. We respect their efforts to join us in helping to solve problems in our state, especially these state agencies. We cannot do it alone. State Representative Fred Crespo, who I worked with well on the Audit Commission, has talked about necessary pressures that we must put on agencies, particularly in their budgets. If departments aren't doing what they're supposed to, maybe cut their budgets. The point is there needs to be punishments. They need to be held accountable for their lack of doing their job. We can all go into solutions that our caucus has presented, legislation that we have filed right now. But I know we don't have all day. These audits have repeated issues, most of them, like I said, for decades. These agencies are essential. We've seen what happens when we're left out of the conversation. When there is no access, when there's no accountability, there's federal investigations, there's corruption, and Illinoisans can't wait. They can't afford to wait. Now I'm going to introduce my colleague, State Representative Steve Reich.
Hello. Hi, folks. Tony's face is still there, but I'm talking to you. I'm Steve Reich. I'm state representative for the 63rd District in McHenry County. And as many of you know, if you've been to these press conferences before and have followed anything I've been doing, you know that I have been working for the past 5 years to try to do something about fixing the problem that is the Department of Children and Family Services. Unfortunately, this week we were confronted with an audit of the DCFS from the Illinois Auditor General, where the Auditor General issued an adverse opinion on the department's compliance with specified requirements of their examination. As one who used to be an auditor, this is the worst thing that can be said by an auditor about any entity that it's examining. An adverse opinion, according to the standards that are established for issuing such an opinion, says that the practitioner, the auditor, should express an adverse opinion when the practitioner, having obtained sufficient appropriate evidence, concludes that misstatements, individually or in the aggregate, are both material and pervasive to the subject matter. Basically, what that means is that they've been lied to. Things have been hidden. They've had to ferret them out. And what they have found, what the auditors have found, is damning enough for them to say they cannot issue an opinion on that agency or that entity that gives us any hope that it's redeemable. If it's a financial audit, that's one thing. It usually shows that the company is on its last legs and is probably not going to be around anymore. But what we have here is an audit of an agency that takes its responsibilities so lightly that we're leaving abused and neglected children in our wake. This cannot be allowed to stand. There are many egregious failures noted in the audit. First, there are 33 separate findings, of which 17 are Category 1 findings, which disclose material weaknesses in internal control or material non-compliance with state laws and regulations. I'll give you a couple of examples. 1, 100% of reported suspected abuse or neglect of a child while receiving care in a hospital were delayed from anywhere from 34 to 885 days from the investigation date. The agency's response that there was no mechanism to monitor and track field investigators' notifications due to employee oversight. Here's another one. 96% of indicated sexual abuse notifications to schools were up to 908 days late. The agency responded that investigators were reluctant to violate a private family matter. I got a phone call this morning about a high school in my district where this is going on. This hasn't stopped just because the auditor said it, the agency said it would. 22% of employee evaluations were not done and have been out of compliance since 2008. The agency's response: completing evaluations is not tied to supervisors' salary increases. So if your salary is safe and your increases are guaranteed, you don't have to worry about employee evaluations. Here's one that as a member of JCAR, I'm working on right now. 43% of daycare provider licensing reports were not reviewed. The agency said it was due to a lack of resources. This audit report is full of things like this, and the constant drumbeat of excuses by the agency is what can be expected from this agency, having been dealing with them for the past 5 years. Lack of resources, turnover, workforce changes, and limited knowledge base. Competing priorities, making it impossible to reach out-of-state providers. Staffing leadership changes, employee turnover, lack of training, staffing issues, delay in issuance of employee credentials, retirements, employees working from home, lack of facility managers, and COVID. These are not reasons, these are excuses, and these excuses are not good enough. If the agency can agree with the recommendations all at once, and it agreed with all of the recommendations made in this audit. But until it starts to follow through on those recommendations, I'm not going to believe a word they have to say. I've been trying to reform this agency since 2019. This isn't new to me. And since I became minority spokesperson on the Adoption and Child Welfare Committee, I made it a point to try to work with this agency. I felt that by working with the agency instead of standing apart from it and doing nothing but criticize, I could help it navigate the changes it needs to be made for it to become an agency that's focused on its core mission of protecting children from abuse and neglect. The findings of this audit are a slap in the face. It's a slap in the face of everyone, Democrat, Republican, House, or Senate, who's worked so hard to try to understand what's going on with this agency and what we can do to help. Many of you have sat in on press conferences where you've asked me, would I call for the director to resign or be fired? I've resisted that. I've resisted that simply because you could replace Mark Smith with Saint Germain Kazan, who's the patron saint of abused children, and nothing would change. Responsibility for this adverse opinion lies squarely at the feet of the governor. The years covered by this audit fall entirely within his administration. While he continues to try to blame previous administrations for the failure of this agency, he owns this. This has happened on his watch. He has full responsibility. He recently ridiculed Republicans for irrelevance in state government. Okay, Mr. Governor, you can't have it both ways. You can either say that we're irrelevant and then not take responsibility for failures such as this. He's been good at blaming Republicans for not going along with his agenda. But what he's really trying to do is to force us to share the blame for his administration's incompetence. He's left far too many abused and neglected children in his wake. It's time he, the governor, was held responsible for this. The gloves are off. If this is the kind of response we're going to get from an agency that feels like it has no reason to work with us because it knows that it's going to be here long after we're gone, then I am not going to be silent about what I see are the shortcomings of this agency and what I think need to be done and what the Republicans need to be done. And believe it or not, there are a lot of Democrats who agree with me as well as to what needs to be done. So I'm happy to answer any questions at the end of this, but right now I'll hand it over to my colleague, Bill Hauter, who will talk about the other stuff that we brought up this morning. Thank you.
Well, thank you, Steve, and good morning, everyone. My name is Bill Hauter. I'm the state representative for the 87th District, which is a lot of Tazewell County, Logan County, Morton, Clinton, Lincoln, Illinois, and I'm also a practicing physician. I'm board certified in anesthesia and also emergency medicine, and I'm the chairman of the Department of Anesthesiology at OSF Hospital in Peoria, Illinois. So I should also mention that I'm in the ORs today, and you may hear some overhead noise, and I'm sorry for that if that's true, but I'm actually in the ORs, and I'd like to talk to you today about a hearing we had with IDFPR, and I'm on the healthcare licensing committee, and we have had a frustrating increase in the delays in healthcare professionals licensing, and it's become a problem that just has to be solved because of the delays in healthcare licensing for many professionals that previously, during the pandemic, we had an expedited process. And since that has ended, we have gone into basically a disaster of healthcare licensing. Patients are suffering because healthcare professionals cannot get licensed in Illinois. Medicine has become very mobile, and we are getting temporary workers. We're getting what we call locums workers from other states, and also new healthcare providers, whether they be physicians or dentists or pharmacists, that are coming to Illinois or newly graduated are having immense trouble getting a license. And we don't know if it's going to be, 2 months, 6 months, 8 months, and there's horror stories all out there. I would tell you a typical story, but it's a horror story. Every story has become just a absolute disaster of trying to get their healthcare licenses through Illinois. And it's not like it's a problem all over the country. It's just in Illinois. And so you look around states around us, and we're talking weeks before they get their license. In Illinois, it's months and months, and it's variable. There's no time frame that we know when we can get our license, and there's no one answering their phones, and patients are suffering, patients are delaying their care, patients are going elsewhere and to other states to get care because they cannot get someone that can take care of them. For example, if you were a newly graduating surgeon and you had a job offer, and so let's say you're from Indiana, you were graduating for residency July 1st, after 8 years of medical school and surgery residency, you're finally going to get a highly compensated job in Michigan or maybe in Indiana, or you're looking at a job in Illinois. Those states can start you working within probably as soon as you graduate or soon after. Would you take a job in Illinois when you may get a license in September? You may get it in December, or it may be, the next year before you could get a license to practice surgery. It's not only patients are suffering, but Illinois is suffering. When we're talking about, in this day and age of trying to bring people to Illinois, keep people in Illinois, and we're talking about some of the most highly compensated jobs in our economy, whether it be physicians or dentists or nurse practitioners or PAs or pharmacists or veterinarians or CRNAs, all these people are having immense trouble trying to get their license. These are people that are not only highly compensated, but their tax dollars and the people that they serve, all of these people are part of the ecosystem to keep people in Illinois. And we're failing them, and we're failing Illinois. And it's outrageous, and it's untenable. So I'm talking to you today, and I think there can be a bipartisan solution. The chairman of the healthcare licensing committee, Chairman Morgan, is very attuned to this. This is a win. This is a bipartisan win. All Democrat legislators and Republican legislators are having so many troubles. Our offices are inundated with people having trouble with their licenses. And so I think we can go back to, and we can in veto session, address this. We need to address this on an emergency fashion. We can go back to the temporary system, to the emergency licensing of healthcare professionals. And also, it's part of licensing 101 that when you send in your information, all your information and your credentials to be licensed in some healthcare profession, that you would get some receipt that they've gotten all your information, they've cashed your check. But that's not done in Illinois. And so, again, patients are suffering because someone is not moving a piece of paper from one place to another. And we don't have to accept that. And so I think that we can find a bipartisan solution. This would be a perfect case where we can get together in veto session and change things. We have to. So thank you for listening to me, and thank you for coming. And